Good afternoon. A warm welcome to you all to this meeting of the Petitions Committee.
Next item is apologies, substitutions and declarations of interest. Rhys is joining us online, Rhys, and we're just awaiting Vaughan Gethin to join the meeting, but we'll continue, we're quite, so we'll continue. We've had no apologies as yet. So we're going to start with new petitions, and the first petition is 2.11488, establish a care society to tackle the long COVID crisis in Wales. So the petition reads, Wales is grappling with escalating long-term illnesses from long COVID in previously healthy children and working people. In Wales, more than 12,000 have died with COVID, in brackets 1 BBC. As many as 300,000 are battling long COVID, and in brackets 2 ONS. Families are losing income providers, brackets 3 bylines, and hospitals under extreme pressure, brackets 4 Wales Online. School absences more than doubled, bracket 5 BBC 1. By 2030, 1 in 3 could have long COVID. We call for a care society to safeguard our health and livelihoods. The submitter of the petition is Elizabeth Tremblay with 260 signatures. So earlier I was pleased to meet the petitioner and members who wanted to discuss the petition. And there are 3 areas that they would like us to look at. A universal basic, well, 5 areas actually. One of them is funding for long COVID research in clinics, workplace adjustments. We heard from Sian, who was saying she used to work for the health board as a physiotherapist, and she felt like she could perhaps still continue to work if there was flexibility, but that was unable to be offered to her. And in the end, her employment was terminated because she wasn't able to fulfill her contract as expected, rather than, she felt she could have continued to be employed and with some flexibility. So that's something we could possibly look at. A universal basic income pilot. So that's something, and we've trialled that already with care leavers, so that's a suggestion going forward, so that there's financial security with people with chronic illnesses. We also discussed how the impact of carers as well that need to look after somebody with long-term chronic conditions. Improved air quality in schools and hospitals with better filtration systems, and then green infrastructure and jobs going forward. So how there might be areas there where people could be upskilled and work there in that field of work as well, be retrained. So I think going forward, there's some suggestions. So the NICE guidelines haven't been updated since 2021, so we could write to the government to ask about that, if you feel that's something you would support. We could write to the CAB Secretary for Social Justice regarding the suggestion of a universal basic income pilot. Maybe that's something that they could look at going forward. It seems to me that there are a lot of unknowns with long COVID still at the moment. So maybe going forward, Welsh Government could look at this, and maybe that's something that they consider if they're looking at other universal basic income trials for other areas. They could look at this as well. And then we could write to the Cabinet Secretary for Healthcare regarding considering employment as well. We've got the shortage of skilled health workers. With it being a public body, perhaps there could be more flexibility there. It's something I've asked for at meetings anyway. You know, if we could have more flexibility with the workforce, who at the moment many have to work 12-hour shifts, you know, it might help. So that's something that we could perhaps do as well if committee are minded to do that going forward. But I was surprised, a leaflet was handing out here that they believe as many as 1 in 10 people in Wales have long COVID. So, you know, people diagnosed with living with ME, and maybe there are people that are undiagnosed as well who are living with long COVID. So I think there is still a lot of unknowns and a lot to be considered here going forward. The report says, as of March 2023, an estimated 108,000 people in Wales have long COVID, with ONS estimates of 2.9% of the UK population affected, which is a lot. So, how do you feel about taking this forward, Luke? Yes, would you like to go?
Yeah, no, diolch Cadeirydd. I think the scope of this work is going to be quite large. I wasn't in the meeting earlier with petitioners, but I think this is something that is really needed to be addressed for a number of years now, especially since COVID. Because we know, of course, that the number of people who are out of work overall across all sectors of the economy is significantly higher than it was before the pandemic. So I think there is perhaps cause and correlation there. I think there's a need for government across different portfolios to have a strategy for bringing people back into the workplace who might have long COVID. We just simply don't know. The research hasn't been done on this. The only, it's not necessarily a problem, but just thinking about this logically, the scope of this, I think, goes beyond just simply Petitions Committee.
Yeah.
So I think there's some suggestions you've already made in terms of contacting or writing to other relevant subject committees. I think there's a need to write not necessarily just to the Cabinet Secretary for Health or the Cabinet Secretary for Social Justice. I think perhaps there should be a letter to the First Minister around overall government strategy towards tackling this particular issue. Because the only worry I have is if we're contacting individual portfolio holders, then we'll fall into the trap of silo working, and the overall strategy of the government wouldn't be put together. So I think what I'm trying to propose here, can't get my words together properly, is a letter to the First Minister around the government strategy on tackling long COVID, and particularly those people who are out of work or struggling to get back to work because of potentially undiagnosed long COVID. But the Cabinet Secretaries, so the relevant Cabinet Secretaries, so the Economy Cabinet Secretary, Social Justice Cabinet Secretary and Health Cabinet Secretary are CC'd into that letter.
Yeah.
Because obviously they need to be aware of those specific things. I think it's worthwhile contacting then the relevant committees for those portfolios to see what work or if they've done any work. I know one or two committees have done some form of inquiry into the effects of long COVID, but it's worth just touching base with those committees to see what's happened and to see if they haven't done anything, if they're planning on doing some work. I know from the Economy Committee's perspective, which I also sit on, the work has been relatively patchy, and we've touched on it in other inquiries, but there hasn't been a single inquiry into it, a focused inquiry into it. So there might be a conversation to be had with other committees around, well, what exactly is the forward work programme and how exactly do we plan on then putting recommendations to Welsh Government.
I think that's very useful, Luke. Thank you for that suggestion. Another element was school absenteeism.
Yeah.
So it was highlighted how many young people are struggling with COVID as well. And, you know, so that's another element to it I didn't mention earlier.
Well, that, of course, speaks to the cross-portfolio nature of the issue, doesn't it?
Yes, absolutely.
And I just worry, because of the scope of it, that we could potentially lose... we could lose the point here, which is the government across a number of portfolios has to come up with some sort of strategy, which just simply hasn't happened yet.
Okay, thank you. And perhaps the COVID committee, just so they're aware, of this as well. Okay. Are we in agreement, Reece, as well? Is that okay? Yeah. Have you been able to? I don't need to summarise that anymore. I think it was very clear. Thank you very much, Luke. That was really useful. Thank you very much. So we'll keep it open. We'll write to the First Minister and everybody else. Thank you. So if we move on now to item number 3, I'd like to also, sorry, was remiss me. I'd like to thank members for attending earlier as well. If they're here. Thank you. Moving on to item number 3, updates to previous petitions. So we've got petition 1335, MENCAP